Great. Well, it's a pleasure to be part of this session. My name is Meghan Azad. I'm a co-lead of the International Perinatal Outcomes in the Pandemic, or iPOP study. And I was invited to speak about establishing partnerships and assembling an international consortium to study perinatal health during the COVID-19 pandemic. I tend to like catchier titles, so my alternative would be iPOP, study, story, stuff, and spirit. So I was invited to speak more about the concept and development of the study as opposed to the results. Number one, because we don't have results yet. This is ongoing, but they should be coming soon. And number two, I think because the theme of today is partnerships and research. So starting with disclosures, I have no conflicts of interest pertaining to this talk, but these are my sources of research funding and affiliations. So beginning with the study, I want to first acknowledge that I'm one of 6 co-leads of the iPOP study. And so you can see here that the 6 of us cover 3 continents and many different areas of expertise, which all are important for this large multidisciplinary study. So today, iPOP consists of 157 collaborators in 42 countries, including 21 low middle income settings. So we are definitely still open to having new collaborators join the study. And if you think you are interested, then please reach out. So the study started when we heard anecdotes early in the pandemic, in the first wave, in the first lockdown, that there were perhaps lower rates of preterm birth. And this was reported and followed shortly by reports that actually there were increases in stillbirth rates in other parts of the world. So this was intriguing, and this was anecdotal evidence initially. But we wondered, is this really happening? And is it happening everywhere? If so, what is the reason? And are all pregnant people being affected and all in the same way? So when we brainstormed about this, we thought, well, if there are better outcomes and fewer preterm births, it might be because of less stress. Pregnant women are able to work from home, and that might be less physically stressful. They might be experiencing fewer infections, non-COVID infections, because of the increase in hygiene during the lockdowns. Maybe the lower exposure to air pollution because they're staying home and there's less traffic on the road and so on. But on the other side, we also knew that many people were experiencing increased levels of stress, also changes in nutrition and potentially reduced access to maternity care. So these were potential reasons for having more poor outcomes like stillbirth. So we also wondered about modifiers. So would these pathways and associations differ depending on socioeconomic status, both at the individual or the regional level? Would it differ based on differences in policies or care practices, comorbidities, and so on? So with these types of questions, we had the objective of investigating the impact of the COVID-19 pandemic, not the disease itself, but the pandemic and the restrictions related to it, on perinatal outcomes worldwide, and to identify the underlying mechanisms. It was also really important to us that we would be able to efficiently translate the results of this research to practitioners and policymakers in order to maximize and accelerate the impact of our study. So with this in mind, we felt it was important to establish a truly global collaboration that would enable us to tackle meaningful questions that really could not be answered in single region studies. So like us, many researchers around the world were intrigued by these initial anecdotal reports, and we're starting to do research at their own centers and in their own countries. And that is very important research. But what we felt we could contribute would be to build a team and a collaboration where we combine these data to ask questions that wouldn't be possible to tackle in single region studies. So for example, if we want to understand the potential role of air pollution in these associations, it's not possible to do that in one region that's experiencing the same change in air pollution. Whereas when you have different regions experiencing different changes in baseline levels, you start to have the ability to ask and answer these questions. So that's what we wanted to do, but how did we set about it? Well, this is the story of the iPOP study. So this all started on a Friday in June on Twitter, as many good research studies do these days, where my postdoctoral fellow, Marilee Brockway, noticed a tweet about the first preprint to report on a change in rate of very low birth weight infants during the first wave of lockdown. And I commented on her tweet, and then by Saturday morning, Marilee was emailing me suggesting we should do a literature review. And I thought, well, there's probably not much literature given that the pandemic has just started, so maybe we should be doing our own study, and let me reach out to a few friends. So the first friend I emailed was my colleague Dave Bergner in Australia, and he immediately replied saying, yes, we should do this, and let me reach out to my network. So the three of us started reaching out to the people we knew in our spheres of research. Perhaps not surprisingly, everyone was intrigued by this and starting to think about it. And so people were very eager to play a part. Whether it was also something to do with having all our business trips canceled or just feeling like we wanted to do something to contribute in this really crazy time. I think all of those kind of combined to really stimulate people to want to be involved. So by the end of July, we held our kickoff meeting, and that was attended by over 40 people interested in participating. By August, we had recruited 2 additional co-leads, so Sarah Stock and Helga Zwega, to help develop the protocol. Between July and October, we submitted 5 grants and presented 5 abstracts on the concept of the study, which helped us recruit even more collaborators. We were able to get seed funding secured from ICOTA, the International COVID-19 Data Alliance, to get us started. And by October, we had brought on Natalie Rodriguez, my program director, who had been hearing sort of on the side about this crazy project that Marilee and I had started, and realized, rightly so, that we needed some administrative and operations support, which she brought with her MBA experience. So by October, we had published our first paper together. This was a commentary in the Lancet. And by November, we had welcomed our 100th member of the iPOP team. So it was quite a whirlwind in 5 months to go from a tweet to a 100-member consortium. In the 5 months that followed that, we were really able to start taking action and getting the study underway. So by January, we had distributed £85,000 in funding to 21 collaborators to support data provision. In February, we published our protocol. So it's online at Welcome Open Research if you're interested in reading in more detail about the study. By March, we had our data contribution agreements executed and our first data submissions arriving. And by April, we were able to begin analysis. And so for those of you who do international research collaborations, you'll know that this is incredibly fast. For those of you who don't, it might sound slow. But the reality is that to get 150 collaborators signing agreements and contributing data in that short a period of time, these are things that can take years in normal times in academic institutions. So it's been really quick progress on that scale. So what about the stuff, the infrastructure that we needed to carry this off? This is our governance structure. So I introduced you early on to our 6 co-leads that cover a number of different disciplines that are important to the study. We also have working groups. So related to the protocol, developing the lockdown exposure variables, the perinatal outcome variables, and the different statistical approaches that we'll be using. We have working groups related to each of the different mechanisms that we plan to explore. So air quality, maternal stress, and so on. We have a low middle income country working group with representation from 3 continents. And we also have a data and infrastructure working group. And then very importantly, which I'll speak more to in a moment, we have a knowledge user working group. So our guiding principles have been an important piece of the consortium infrastructure that we established early on. This is a document that very clearly sets out the goals and visions of the project, our general principles relating to collaboration and equity, for example. It sets out the governance structure and the roles and responsibilities of different members on the team, talks about research integrity and data protection, communications and document sharing, and also really clearly explains the process and conditions for authorship, confidentiality, and so on. So this is a really important document. It's not a legally binding document, but it's written in plain English for everyone to clearly understand what they're signing up for and to agree at the outset. Technology platforms have clearly been really important for the success of our study. We use Zoom to have meetings. We use Google Drive extensively to share documents and comment on them. When you have dozens of people working on a document, you really don't want emailed Word documents coming back at you. We also use Slack for communication for the same reason. You don't want emails flying from 150 people back and forth 24 hours a day in all time zones. So Slack has been a great place to have communication streamlined. We have channels for different working groups and different topics. We have channels where people can come and ask for help if they're struggling with ethics or data submission. And we also use World Time Buddy, which is a great little app for arranging meetings when you want to see kind of where all the time zones align. Getting our data contribution agreement established was a really important milestone for the study and is a key piece of infrastructure. This is an absolute necessity if you're sharing and contributing data. And so that was no small feat to get established in such a short time frame. We developed data submission templates so that everyone contributing data would be doing so in the same format, and so that we could write our code to import and translate data from those specific templates. We developed an FAQ document around ethics. So it's been interesting. Not every site has required ethics locally to provide aggregate data, but some definitely have. So having a document where they can come to and copy paste different language and text about the study has been really useful for streamlining that process. We've held multiple drop-in sessions where people could drop in if they're having trouble with the data submission, speak to one of our analysts on Zoom and get advice and clarity and answers to their questions in a quick manner. A very important piece of infrastructure has been our human resources. It takes a lot of time and a lot of people to coordinate all of the communications and emails and agreements. So that has been really key and something I probably underestimated at the outset, just how much work it would be. I promised to talk a little bit more about the knowledge user group. So this is a core philosophy of iPOP, and Marilee Brockway has taken an important lead on this part of the study around patient and knowledge user engagement. So we really view patients and knowledge users as experts, just like the researchers. And we believe that incorporating them into our research helps us develop meaningful evidence and outcomes. It truly increases the uptake of the evidence because those stakeholders are right there as part of the team, and it reduces research waste. So I've shown here some of the partners that have been involved in the iPOP study right from the beginning. We had meetings early on back in the summer with the UN Population Fund, the WHO, World Vision, the Public Health Agency, the Healthy Newborn Network, and various parent groups in order to tell them about what we were planning, get their feedback from the outset to inform the design of the study, and keep them engaged throughout the process so that as soon as we have results, they'll be the first to know and be able to use those in developing policy and practice recommendations. So the success here is truly based on meaningful, early, and collaborative engagement among all these different stakeholders. So finally, the spirit of iPOP. We really buy into the team science approach and the idea that if you want to go fast, you can go alone, but if you want to go far and have a meaningful impact, it's best to go together. So what I think that team science really allows for is when you do it right, you have open communication, you have engagement from all your collaborators, you share a unified vision and common goals. You have expertise to overcome barriers. Because you have people from so many disciplines, you're able to pivot quickly and to overcome barriers in different domains. And having those people from so many different disciplines and having the knowledge users involved allows you to be truly translational in the approach and really helps increase your capacity and productivity. So ultimately, this hopefully leads to impactful science and project success. Whereas taking a more traditional siloed approach, you really experience many barriers and aren't able to be nearly as productive as you can with a team approach. So the key elements of team science in our team, I mentioned our guiding principles document. We really try to acknowledge and seek agreement from our collaborators at every stage of the process. We give them the opportunity to comment on documents, so whether those are grant applications or publications. We do this through Slack and Google Docs. We have an opt-in authorship policy. We send regular progress updates to the group so that they know what's going on in the study. We have working groups and everyone is invited to participate in those. And we really champion leadership beyond just the core team. Number one, because you have to when you have so much work to do, but this is really how you foster engagement in the study overall. So I wanted to finish off quickly with some of the challenges we have faced. So the first is funding. We want to get going quickly on a project like this that is so timely, and really you have to get going before you get funding. So juggling both was a challenge and really requires teamwork. And there have been challenges related to the time of the pandemic. So we had, for example, a grant that was, for all intents and purposes, approved and then canceled after the fact because an entire funding scheme was canceled due to the pandemic. There have been some culture clashes. So geography is one source. So having so many different time zones and languages and cultures can cause challenges. Also academically, having so many different institutions trying to work together can be really complex from a data sharing and agreement perspective. also related to authorship and financial sharing agreements. Our guiding principles document has been helpful in sort of setting out the expectations right up front, but it still can be a challenge. And then also I put industry here in quotes, but we are a bunch of academics. We're working with ICOTA, which is not exactly an industry partner, but are this major conglomerate supporting all sorts of different projects and really, establishing themselves as we go. And so the expectations from them are more sort of business-like, and that has been tough sometimes in terms of different expectations around timelines and priorities. But there, the solution has to be clear communication. And then finally, there have been unique challenges around working with low middle income settings, around the research priorities in some of those settings are really different from what we're used to in our part of the world. And just the availability and quality of data is very different. We've run into some instances of unconscious bias, which I could speak to in the question and answer period. And I think really our strategies here have been around engagement. So engaging the collaborators from these settings in the design and execution of the research, also engaging other researchers who are more experienced working in those settings, because it certainly is new for me. Not being afraid to be vulnerable and explain that this is new for me and I'm seeking your help, your advice, and also ensuring representation on the different working groups. So with that, I will close off and I look forward to discussion. And this is where you can reach me or us at the iPOP study if you're interested in learning more.